Good afternoon, class. My name is John Watts, and I'm a student at Colorado Christian University. This afternoon, I want to talk about um, the funding of long term care. Um, and I'm going to start off with slide number one. Um, and it states long term care can be expensive. And if you can see my little capture here, how will I pay for dad's long term care? Um, we all know that elderly people, they are living longer today, and we are placing our parents, our grandparents in the facilities, and we're paying for that care either out of pocket, some type of private insurance. So I hope this presentation um, gives you some insight, help you, and um, determined a factor how you will pay for long-term care and start saving for that type of care. Um, Long-term care can be expensive. Below is just some national average costs for long-term care in the United States. It could cost you up to $225 a day, um, or $6.84 per month for a semi-private room in a nursing home. It can cost you up to $119 a day, or $3.62 per month for um, to live in an assisted living facility, and that just for a one bedroom unit. And also, you have to pay for the health aid. If an LPN comes in to help you shower, bathe, or just to get out of bed, that can cost you up to $20.50 per hour. So, healthcare, long term care can be expensive. Now, choosing the best long term care for your situation. Faith based long term care facilities, uh, as we know, a faith based organization continues to establish themselves as actors in the public arena. The importance of studying their impact on public policy grows. There are a number of aspects to the debate on the faith based provision of social services. An important dimension of the controversy lies in the effectiveness of the organization when compared to those with a secular orientation. Slide number four, just go over what is long term care. Long term care involves services that meet a person's health and personal care when they are no longer able to perform these tasks safely on their own. Nearly 11 million people in the United States use some form of long term care, and that number is projected to double by 2050. A person's age 85 and over are the fastest growing segment of the population in most developed countries that tends to be less healthy and are more likely to have chronic conditions that require care than younger people. While there is some evidence that disability rates among older people have doubled in recent decades, this trend may be reversing. The total number of older people is rising, and the number of years of care that people with disabling condition require may be increasing also. So, care such as bathing, dressing, preparing meals, getting out of bed, those are things that comes along with long-term care, and those things are quite expensive as well. Now, type 5 talks about, um, slide 5, I'm sorry, talks about long term care in our government. The government alone cannot solve the social problems of our time. Implementing public policy decisions requires the government to form more partnerships with um, other communities or more commitments with outside organizations. Um, so President Bush administration hoped to give a larger role to faith-based organization in delivering social services. This research is governed by the following two questions. Are nonprofit faith-based nursing homes more effective in providing Medicare and Medicaid services compared to their secular, nonprofit, and for-profit counterparts? Are more religion nursing home, regardless of ownership, type affiliation, more effective in providing Medicare and Medicaid services compared to their less religious counterparts? To this studies to this study, ways to pay for long-term care. Just as there are many kinds of long-term care services out there, and I'm on slide number 5, and they're just talking about ways to pay for long-term care. Um, like I stated, just as there are many kinds of long-term care services out there, there's also support. There is a wide range of costs for them as well, and some people may qualify for public program to help pay for these expenses. Most people use a variety of options, including long-term care insurance, personal income and savings, life insurance, annuities, and reverse mortgages to ensure they can pay for care they require. As our population ages, new financial products are offered, yet more options. I'm going to continue to slide number 7, and it's continue to talk about public government funding and private sector funding. In his State of the Union address in February of 1986, President Ronald Reagan asked the U.S. Department of Health and Human Services to study and provide recommendations on ways that the private sector and the government could work together to provide American families against the cause of catastrophic illnesses, including the sometimes devastating cost of long-term care. Secretary Otis R. Bowens, who has had a long-standing personal and professional interest in catastrophic health care costs, he accepted this challenge. I'm going to move on to slide number 8, and it talks about public government funding and private sector funding. In 1986, almost half of all nursing home expected expenses, was paid by federal, state, and local government. The Medicaid program paid 41.1%, and an additional 6.4% was paid through Medicare. The Veterans Administration programs and other non-Medicaid state programs, most of the remainder, 51%, was paid directly out of pocket by older persons and their families. Private health insurance paid less than 1% of their nursing home costs. It is this later private sector portion that we think could leverage to become a significant factor in protecting the elderly from financial burdens of a large out-of-pocket expense. I'm going to move on to slide number 9. It also talks about the private sector of long-term care. Private sector managed healthcare organizations are experimenting with ways to better coordinate home care and community services. An even more promising approach is an aging network that allows local network profits and government agencies to work together to assess the needs of each older person, identify appropriate services such as home aids, and administer cost effective community programs. Family and older people find agent networks good to work with because they provide a one stop information and supportive social network. The emphasis is on care and not profit. I'm going to move on to slide number 10. Managed care encourages savings through the private sector. Uh, One method that has been used to save money and encourage home care for seniors involves integration of different sources of funding from Medicaid and other public and private sources. In the private sector, managed care long term umbrella program operating at the local or regional level. This program receives funds from various sources and pays out a set per person rate to purchase care from various companies, including a nursing home, along with home care companies, whichever works at the that Pacific, a Pacific price. Now, over the past 15 years, various managed care programs have developed around the country. They vary a great deal in the type of help, the range, funding resources additional to Medicaid, and also it helps with nonprofit and elderly care services. I'm going to move on to slide number 10. Um, and just like I said, keep the faith. Long term care is an ongoing battle. There's a lot more we need to know and know quickly. In my conclusion, this week on this presentation, in order to assure that our future long term care system is responsive, effective, and desirable, the department will continue to foster work in long term care and wants to work with insurance companies and actuaries and state Medicaid program directors, as well as the traditional academic community, to improve data on long term care needs, financing, and the economy status of a person who is in need. And that concludes my presentation tonight on long term care. Um, Slide number 12 list of my references. Please feel free to click on them. There's plenty of information out there under these links to read about long term care, how to fund long term care, um, information you need, how to deal with stress and financial burden of long term care as well. I hope that this presentation was helpful and for you. And when it comes to that point in your life where you need long term care for a family member, or you want to go ahead and start saving for yourself, I hope that this information, the research, and the links under my reference page will guide you in the right direction. Thank you so much for listening and have a good evening.